some online. So when speakers come up here, do try to speak to the computer. Normally I like to walk, but we're kind of tied here. So again, thank you for everyone for attending both online and here. I'd like to start with the land acknowledgement. And when I was thinking about what I wanted to say with land acknowledgement today, I reflected on the word land acknowledgement. So then I went to the First Nations Health Authority of Medicine, and acknowledging traditional territory specifically focuses on First Nations land, title, and rights, and what it means of raising a broader awareness of First Nations, Métis, and Inuit cultures and history, specifically by the way of our own relationships to land and water. And it's our own relationships to land and water that work within this. And I was thinking of that last phrase and why it would be important as I reflect on this. And I live out, from those who know me, west of Stony Plain. I do commute almost an hour every day, but I truly, really love and cherish the land I live on out there. I raised my family there. I live there now with my husband. We ride our horses. We have a dog. And every day we're out there, it's like, we are just so appreciative of being here on the land. And so when we do land acknowledgements, we should all be reflecting of what that means. And in Stony Plain, it's a tract of land, it used to be called Escatina or Stony Plains, and it's a name derived from Nakota Sioux First Peoples. So as we are in our own, each of our worlds, like think about that and think about the lands you live and work in. So now, as a faculty member of the U of A, I would like to do the land acknowledgement for the U of A. So I respectfully acknowledge that we're located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, and Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to enrich our community. We say these words, it's a canned acknowledgement, but I think we reflect and we use this acknowledgement, and I encourage everyone to reflect as you do the land acknowledgements on your own. And for me today, it was the word land that really sparked my thinking about that. So with that, we will continue on with what we're doing within the Women and Children's Health Research Institute. I didn't even introduce myself. I'm Sandy Davidge, the director of the Women's and Children's Health Research Institute. I'm here with many of the faculty, staff, and members and trainees within the Institute. So it's great to have everyone here. We have a formal presentation, which we've done attached to all your invitations. You had the agenda for today, which is quite a long list of the initiatives we're working on. We're having those that are actually leading those initiatives speak for the areas that they're leading themselves. So that's the main part of the program. You'll find WCHRI a year in review. It's kind of highlights what we've been doing. But if you go on our website, we have a great website. You can also see where we do quarterly reporting to our oversight board if you want some more details. And then our strategic plan is attached to that invite. So I'm not going to do a whole lot of overview of WCHRI because you have the attachments. And if you're a member of WCHRI, you should probably know a lot about it anyways. First and foremost, I'd like to thank the foundations. As you know, we're a partnership, and the partners include our foundations that provide the financial support, the Stollery Children's Hospital Foundation, the Alberta Women's Health Foundation. And since 2006, you can see how much donations and commitment have been done by the two foundations, with over $85 million from the Stollery and over $27 million from the Alberta Women's Health Foundation. So if you ever have a chance, please thank the foundations, thank our partners. We work in partnership. We wouldn't be here with this without them supporting us. Very simple. We have three themes: women, children, and perinatal. And we're all a component of that in our research. And then it's this power of partnership. Obviously the foundations are a critical piece, but when you think of us under the umbrella of the University of Alberta, the two hospitals that are supporting women and children's health, Lois Hole Hospital for Women and the Stollery Children's Hospital. And then we have this nice, unique feature by being able to support both women and children, that maternal perinatal piece, lifelong women's health. We don't have to separate the two. We're in it together because of this great partnership. And I think it is the unique that you don't see across a lot of the institutes across Canada. And this, we also do everywhere from biomedical, clinical, and community health with all the members within the Institute. Our strategic plan, you have it in that 2-page handout. We think of it more simply as where we can support our members, our trainees, our ecosystem and our environment. And with goal 5 being the internal piece, which is our sustainability, accountability to the foundations, our communications to our members and to our foundations and our partners, and stewardship. And we have peoples and processes and partnership and platforms across that. So that is a simplified way of what was in our documents. Of course, WCHRI Research Day is kind of a big highlight of the year. It's a highlight for all our partners, a highlight for our trainees. So please save the date. October 22nd is a little earlier than other previous research days, and that's because that's the only day Weston had the date available for us. So please note in your calendars, October 22nd. And with that starts the official program. I have to go back to my agenda. As you can see the agenda, I have some housekeeping notes. We're first going to have Keaton Tiernan come up relative to the Training Advisory Committee. He's the lead of that. But before we go there, I'd like to give instructions to the rest of our leads that are here, because there's lots of leads and lots of presentations. So we're going to have you guys come up in twos, because you'll see your photos up there, and then introduce yourselves. We're not going to go back and forth from the camera, and introduce yourselves. And I'm really looking forward to hearing what each of you have to say about each of the areas that we've begun initiatives within WCHRI. So without any further ado, Keaton, I'll have you introduce yourself as our Training Advisory Committee.
I think I rolled it right at the right time. I just came from class, but I'm happy to see everyone here today. I'm sorry I'm wearing a mask. I'm recovering from a cold, and if I sound a little hoarse, that's why. But again, my name is Keaton Tiernan. I am the chair for the Training Advisory Committee, which is composed of students and fellows from all academic levels, including undergraduate, graduate, and postdoc. We try to represent, or do represent, all 3 WCHRI research disciplines, which is women, children, and pregnancy, and the 5 pillars, CIHR 5 pillars: biomedical, clinical, health services, social, cultural, and population health. If I missed you, please don't be offended. Are also represented on the board. And with all that being said, we aim to advise on WCHRI programs and kind of increase or really reach for that trainee engagement and trainee voice at the programming level. And we try to create programs for WCHRI trainees for their professional development and career trajectories. So what have we been up to over the past year? So we restructured in June. And from that, we formed the mentorship, outreach, and recruitment subcommittees, and the technical skills and equity focused also subcommittees, missed those. And we completed a very successful year for our mentorship program from 23 to 24 in June, and are currently helping to facilitate another successful programming year, this year, 24 to 2025. It was actually in this room, I think 2 weeks ago, we had a very awesome career panel for the mentorship program, which was very well attended and had high praise all around. Also in October, we held a TRC Day event, which was led by TAC member and equity subcommittee co-lead Shannon Cornelison. And that was also very well attended and reviewed. And just this past month, we launched a monthly COP, which we piloted in September and October. I think that's everything.
Great, thank you. And then you can do the slide, then we'll know if the next people are up.
WCHRI. You're up.
Each speaker can thank the speaker before them too.
Thank you. That's awesome. I'll just wait for, so
One at a time.
one at a time. Okay, perfect. Okay. Don't save me time. Hi, everyone. So my name's Lonnie Swagenbaum. Let's see my name's Lonnie Swagenbaum. I'm a developmental pediatrician and clinician scientist with a focus on autism. I've been a WCHRI member since I first arrived, I guess since WCHRI's inception around 2006, 2007. And I feel very privileged to be in this role of associate director and lead for child health research for the past 6 months or so. In that context, I'm delighted to be here to share a little bit about the child health area. And I'm particularly excited just to have a chance to meet many people that I haven't had a chance to meet and hear your thoughts of how we can further support child health research, researchers and trainees, and how we can continue to build on the strong foundation of WCHRI's supports and accomplishments. I think the strategic approach is very much aligned with WCHRI's overall strategy to really think about sort of an inclusive and supportive ecosystem where we're supporting the membership through all stages of training and career stage, from stimulating interest among undergrads, sort of thinking about a career in research and child health research, all the way to senior investigators and thinking about how to help support them and taking the next step to be the lead on a new national grant or major program. We support the breadth of research from preconception to childhood to transition to adulthood. Again, we're really proud of the unique partnership and scope of WCHRI and really thinking about from women's health to the interface of pregnancy and perinatal and prenatal determinants of health all the way through childhood and transition. From rare conditions that may be determined by a single genetic or biological difference, all the way to thinking about social determinants of health and population health issues that have a significant impact on the population. From bench to bedside to community, and in particular, recognizing the value of basic research as well as translational approaches, as well as clinical trials. And from that respect, sort of having an inclusive approach of valuing the methodologies that are needed to address this breadth of questions. And finding that balance between taking that inclusive and supportive approach and also highlighting and prioritize areas where we really do lead nationally and internationally. And from that perspective, to prioritize and cultivate partnerships. And just looking around the room, I think it really exemplifies the partnerships with the Stollery Children's Hospital. And as Sandy had commented, with the foundations that support the research and really champion the work of WCHRI members. I'm really excited to just be here as a participant today. The major areas of focus within child health research, for the most part, are represented by leaders that will be talking about these individual programs of research. I'm also delighted to be working with Sandy, who's been such a terrific director and whose own research program really highlights the power of the interface between women's health and child health research, and in particular, helping us think about prenatal determinants of health to genuinely come up with strategies, even sort of prenatally, to help enhance health and well-being throughout the lifespan. The application of new technologies and innovations, an increasing focus on precision health, and we'll hear about the Translational Genomics Hub, as well as the new stem cell facility, really creating exciting opportunities for greater tailored, individualized approach that can transform children's lives. Huge strengths nationally and internationally in leading clinical trials, and clinical trials are such an essential component of translating discovery into impact and accelerating the process of what we learn actually impacting on patient care and well-being. And also really excited to be here with my friend and colleague, Grant Bruno, who'll be talking about his leadership of the new Indigenous Child Health Program. And that takes us to the Translational Genomics Hub. So thanks again for the opportunity, and looking forward to chatting with you later in the session. Thank you.
So the Translational Genomics Hub, so this is part of the Precision Health platform. I'm Todd Alexander, and with Juana Calaceru, a medical geneticist, we've co-led this. Well, we sort of instituted it largely with the help of Tanya and Hism and Farah now, and has sort of evolved over the last few years. So what do we do? So child or adult, actually, with an undiagnosed condition goes through the typical healthcare system, and they get to a place where they don't have a diagnosis. And this is unfortunately far too common in our hospital across the street and in my department. And if the condition has good reason to think that it's genetic in origin, we can help. And so what we've done is really two things, well, more than two things, but there's two things we can contribute to help. One is if the child has had all their exomes sequenced, we can reanalyze that, because you can imagine there's about 300-400 new genes and conditions every year. So, 2 years ago, you get your whole exomes done. Now, we should revisit that. So we can do that. The screen's working. And the other thing is, if you don't know what's going on, we can look for new genes that are causing diseases. We've had some success in both spaces. But it's more than that we've done. So the first thing I think that's important in the way this works is that the clinician comes to the hub. So clinicians, busy healthcare system, you've heard, lots of patients. Perhaps we need a few more beds. We could probably use some more clinicians right across the spectrum. So, for them to go out and get ethics, for them to then, Google, find the right collaborator is really a barrier. So I think of the hubs as a catalyst. I was just teaching my daughter what catalysts were in biology, but I look at it as reducing the barrier, right? So if you have a patient, I don't know what's going on, I know this patient, to write it up, you bring them to the hub, and then the hub, a bunch of bright minds, it's a community of basic scientists, geneticists, translational researchers, who will then evaluate the case and say, okay, I think the next thing for this child might be to do whole genomes. And we've got resources and the connections to do that. So then we can collect material, we can isolate DNA, we can then move it to whole genomes. Or maybe we need to model a gene. So you get a VUS. I don't know, a few people have heard about a very unknown significance. Is it significant? Is it not? Okay, we know a scientist over in medical science, California, wherever, they can model this genetic variant and tell us, does this, the gene, the protein that results from that gene, does it work or not? So then we can say, yeah, it works or it doesn't. And this has been very important because you need often to access some of these very expensive drugs, evidence that you have a genetic condition. So we've enabled some children, A, diagnoses, but B, access to a treatment they wouldn't have otherwise had. So what have we done so far? We've reanalyzed 50 exomes. We get about a 10% yield. So 5 of those 50 exomes, we were able to provide a diagnosis. The other one, we've done 24 cases and completed 7. 3 candidate genes have been sort of confirmed, and we're working towards more confirmation. It takes time. You can imagine you got to model something in a cell model or an animal. And so this has led to improved health outcomes. And so that's what we've done. The other piece that, besides becoming a catalyst and decreasing the barrier, that has been, I think, I didn't realize going into it we're going to go there, but has been very useful. And I thank Tanya for her work, is that it's created access to and collaboration with a number of national and international networks. So we now, because of, I'll say quite frankly, Tanya's persistence and her ability to continue, the U of A now is part of, has access to Genomics England. So all of their genetic data that we can then validate what we're seeing here from. All of us through the NIH, we become a member of the Global Alliance for Genomics and Health, member of the Canadian Rare Disease Network, so we can collaborate and work nationally in that space to try to understand these variants or new diseases. And so really, it's been quite an honor to be part of this, and I've learned a ton. Hopefully we've helped a few children, we'll help many more going forward. There's a website, I didn't put it up, we have a QR code, we're fancy. So you can get a link, but if you have clinicians with unknown diseases or families, please reach out. There's a link and you can bring cases forward. So with that, thank you for the time to share about this initiative.
All right, Tanse Kakio, hello everybody. My name is Grant Bruno. I'm a assistant professor in pediatrics. I'm the Indigenous Health Lead for Child Health here for WCHRI, and I'm a registered member of Samson Cree Nation, one of the nations that makes up Musqueam cheese, located about an hour south here of Edmonton. And today I'm going to be presenting on Ispimic Awasasak. And I think it's really important to understand that everything that I do is informed by ceremony. So ceremony for us, if you're not familiar with it, I only have 3 minutes. I'm not going to explain it. There are YouTube videos, actually. You can go learn more about this. But ceremony to me is really important because it's the foundation from which everything else operates from in our community, whether it's on health or education or anything that's involved in the community always has to be informed by ceremony. And so we actually went to ceremony for our name. So Espimik translates as sky children, and it means children from above. It means the children who aren't here anymore, but also the children who are coming. And so our program is now responsible for all the children. And I had the elder talk to me afterwards. He said, Grant, those are all your kids now. And I take that role on very seriously. So it's a community university partnership. So between WCHRI, the Department of Pediatrics, and then Musqueam, but we are looking to expand, of course. We're in the very early stages, we're about a year in, of trying to see what this looks like across Treaty 6. We currently have 3 community coordinators, or research coordinators, who are all supporting the work. Again, a lot of the work that I do is strength-based, so it's really trying to address the challenges we have in our community by understanding that there's so many strengths as well, and it's staying away from those deficits, really. The program objectives, of course, is to implement pediatric health education and promotion in the community. So Musqueam actually has like a brand new pediatric clinic that we support, and is clinically supported by Dr. Heather Dreiss. And so myself and her, we have, I think, a really great duo. And I think what a lot of other Indigenous communities wish they had, because I keep meeting with communities across Canada, and they're like, well, how do we get what you get? And you have to start training people from within. And that's why I'm always grateful for the support from WCHRI, because I feel like I can do the work because I am supported. One thing that we're really keen on, though, is understanding access barriers to healthcare and services, right? So there's a lot of challenges for a family to get healthcare services. These could be institutional challenges. These could be jurisdictional, legislation through the Indian Act, but they could also be internal. That's what I'm learning is a lot of families are they have a fear of the healthcare system. They have a fear of authority. And so we're trying to figure out different research projects to start to address this. We also have meaningful and ongoing community engagement. So we do multiple ceremonies. We continue to do ceremonies within WCHRI, but we also do them in community. And our ceremonies are a way of engagement. They're a way for me to be in the community, connect and learn from, and allow the community to tell me what to do. We also did a round of strategic planning sessions. And then we also have our community advisory circle, and they're the ones who tell me what to do, and I just go do it. We build evidence through data collection and research, and then identify and develop mentorship opportunities. And so we're actually developing a program right now for the careers in health sciences. And so we're looking at actually developing a health career day for high school students in the community now to come and learn from us and learn from clinicians as well. So this is the model that we use. So it's the Turtle Lodge model, it's called. So Dr. Leon Makokis, who is actually one of the elders that I get to work with because of WCHRI, developed this model around children's health. And in it, you can see the different elements that would create good children's well-being. So in the middle is awa sis. So in our world, or my language, awa means spirit, sis means small. And so we view our children as small traveling spirits, actually, and they're much more created, much more connected to the creator than anybody else. And they're actually here to teach us. And then around that, we have this other word, wakamitwin. And so this would include all of you. So anybody who has any connection and at any level to our families would be considered good relationship workers. And so this model is something that I use quite often. Again, ceremonies built into it, interconnectedness, relationality, all these different elements that I'm trying to build into the programs are all connected back into this model. So what's next? So we're developing specific research methods. So I'm developing a qualitative method. It's a method around Wakotowin, which is our law around relationality. We're developing a ceremony-based invention for youth. We have the Indigenous Caregiving Collective. So we're taking a family-centered approach. We're starting up the Treaty 6 Hunting Society. Next month, we're coming out with Kiswatsuwak. They are sacred documentary. We're having a Maori and Nehia research exchange. Special Olympics Canada is coming to the community. All sorts of different autism-related activities, sensory TVs. Me and Lonnie are going to develop an assessment tool. We just figured that out about 10 minutes ago. And then Indigenous experiences with autism diagnosis through One Child, Every Child. And then, of course, always ongoing ceremonies, which will continue to invite people to come and share and learn from us. Then I scope them in. Thank you.
Hi, everybody. My name is Dory Sample, and I get to talk to you about one of the initiatives that WCHRI is involved in, which is the pediatric clinical trials. So my role within that team is essentially to kind of bring together very skilled individuals give them accesses to things if I can. Connect them with other people, make sure everything is in order, give them what they need to be successful, and then kind of get out of the way. So what we have is an extraordinarily skilled team of about 20 study coordinators, about 16 FTEs. And when everybody looks at that, they say, oh my gosh, that's so many people. It's really not. We do an awful lot of work with that team. And so of those 20 people, we've got a mix of full-time, part-time, some casual, just to kind of fill in all the gaps. So people can come to us with a study and say, I really only need someone for like 4 hours a week, where they would not be able to hire somebody to help them for that period of time. We can help do that. Other projects might require somebody dedicated completely to supporting that. And because we have this mass of people, that sounds like it's a large number again. It's not. I keep telling Sandy, it's not. People can cross cover. So every time we have a clinical trial, somebody will own that. That'll be their baby, working with the investigator on that particular trial with those patients. But somebody will also be in the background as a backup, because people do get sick, or they take vacation, or they might be working on another study and they're in clinic with a different patient. And patients are always first with our team. So we've got a very experienced team. This is just a tiny little number of them. We need to do more pictures again sometime, and we will try and get everybody in a picture. It's hard to do because people are in clinic, or they're in the desk, or they're in a meeting, or whatever. How do I go to the next one? So at any given time, this team supports at least 60 clinical trials at once. And some of these are extremely intense trials. We can now do phase 1 clinical trials in kids. We're one of 2 sites in the country that can do that. It's really quite a unique thing to be able to do. Some of the kids stay overnight. We do, blood work at ridiculous hours, and it all works. And by doing this, by putting in all this extra time, by working so hard to do all these unique studies, we're providing access to treatments that these kids would otherwise not have access to. And we're moving that pendulum forward in getting new drugs approved, so that ultimately these kids with these diagnoses will have new treatment options available to them. And that's why we're all here, right? In this space. That's why we're here, is to help kids get healthier. So we also do cohort type studies. So those are the studies where maybe you're doing a questionnaire, maybe you're just doing a chart review, maybe you're doing gathering blood, things like that. So it's not a clinical trial. Super important stuff to do too. And we learn a lot, and we can help improve health outcomes for kids. But it's a lot of work, all these different types of studies. To get there, we help work with the docs on feasibility, on site selection. Sponsors will come out and make sure that we have all the things that we need, so that if they like us, they'll say, yes, we want you to be in our study. And we've never been told that we are not liked. Oddly, they always say yes. They always want to include us. And then we have to kind of figure out how to make it work, which we always also do. So we can help with ethics applications, with the consent revisions, all of the administrative stuff in the background. The entire goal of all of this is to make it as easy as possible for an investigator and the participants to take part in the research projects. From an investigator standpoint, they couldn't do this without support, most of them, because they don't have their own study coordinators that work with them. And when you have people who are really experienced, you can do things quickly, and you can get things off the ground, and it makes a huge difference. We do the financial management for all of our clinical trials. So all the money coming in, money going out, we manage all of that, which is great. So we're working hard at making sure there's no money left on the table, and that the investigator doesn't go broke, which is important, because I know that has happened to some of them previously. And that is essentially what we do. We're trying to make the kids healthier in the future and now.
Just let them know Sophia's delayed. I'm just go.
Okay.
Go right. Okay, so we are going to hear from Sophia in a little bit because she is a little bit delayed. She's in another meeting. Oh. Oh, those are not yours. Okay. I'm like, wait, what? Okay, sorry. So my name is Laura, and I am the clinical research program lead for women's health. And today I'm here to speak about the Delshire Center for Solutions in Women's Health. So we are both a physical place and a platform. We are located at the Lois Hall Hospital for Women. And as a platform, we integrate and we coordinate different units from WCHRI, and we work to support our researchers. I'm very glad that I went after Dori because she explains really well how research coordination is done. So she took like 1 minute of my talk. So who we are. We want you to think of us as the headquarters for research at the Lois Hall Hospital for Women. We're a team of 5, and the reason why the picture looks so odd is because there's always something happening when we're taking pictures as well. So in that particular time, one of our leads was sick, so that's why we're cut down. I cannot see all of the screen, but if you trust me, over there, there's Sharina, Esther, Maya, and Jenna and Alberta. They are our research coordinators. We have research coordinators from Alberta Health Services, from WCHRI, and from the University of Alberta. We have one research assistant. Her name is Shannon. You have already heard her name once today. She helped us with the Indigenous Women space. Between us, we have different areas of expertise, so we can collaborate and help all of our researchers at the Lois Hall Hospital for Women. And there's a new research coordinator. Her name is Jamila. Jamila is working with us more like in the community space. We're trying to recruit pregnant women in community, so that's her role. She goes and engages with women in community. And we have 2 leads. One is Shona, so the picture is down. She is the lead for Alberta Health Services, and I am the other lead. So as you can see, you have heard enough that I have said Alberta Health Services, University of Alberta, WCHRI, and the Alberta Women's Health Foundation. So I want to stress the fact that we exist because we are a partnership and we work as a partnership. We opened our doors in 2018, and we have recruited over 950 women into research. And by we, I actually include myself. I was a postdoc once, and I worked with Dr. Margie Davenport and Dr. Craig Steinbach, and we were recruiting women within the hospital so we can bring women to the research space who have a complicated pregnancy, and we can do research over there. So that's why it's not a royal we, it's actually a we. What we do, Dori mentioned many of the things that we do. Basically, we support our researchers. In the space, we have multiple areas where we can run patient visits. So we can either do focus groups, we can do interviews, but we can also bring patients, inpatients or outpatients to our center to have research visits. We help with operations approvals and ethics applications. We also work with proposal development, budget creation. And last but not least, we oversee the research happening at the Lois Hall Hospital for Women. And this happens because we are part of the Women's Health Research Committee. So we all sit down and we assess all of the research that happens at the Lois Hall Hospital for Women. We assess the research, we assess how can we do the research, how can we move forward that research. And if you need any help, that's my email over there. You can email me. And I will share the room with Dr. Sophia Ahmed, who just came.
Thank you very much. You just got a lot of panic texts from me that I couldn't get up. So welcome. Hi, my name's Sophia Ahmed, and I've had the pleasure of meeting some of you, but not all of you. And I hope to actually, after this presentation, just chat a bit more. I'm here to just talk to you, just remind you or reinforce what you've already heard that, well, first, I just want to acknowledge that this is a really charged time in terms of women's health research. And I don't think anyone around this room is surprised to hear that. And I really want to emphasize the work that you are doing is so important. I mean, you knew it was important before, but it is even more important because when we hear from our colleagues south of us in particular, but like it's so restricted what can be done right now and so uncertain. So I just really want to emphasize that we support you as an institute, and I hope you feel that support. And if you don't, well, please talk to us for sure. I guess maybe that's the first thing. So, and also just to emphasize, and as Sandy always says, like all stages, all ages, or all ages, all stages, that we support women's health research across the lifespan. And when I should mention, when I use the term women, I mean anyone who of any gender who requires female reproductive care, as well as anyone who identifies as a woman. So it's a very broad term when I say that. And then, so what exactly does that mean? So we support work that is specific to female reproductive care, or I don't mean reproductive care, but to anyone who is female. So this would be menstruation, pregnancy, menopause. These are normal things that happen across the lifespan. And of course, things like PCOS, endometriosis. We look at things, or we support work that studies things that disproportionately affect women. So autoimmune disease, osteoporosis, migraines, breast cancer. And then of course, things that, I don't know why, oh, there we go, that affect women differently. And so cardiovascular disease, some types of non-sex specific cancers, colon cancer, etc. Diabetes is here too. So, and then, so again, just to emphasize we're always looking for opportunities to showcase the great work that's being done here at WCHRI. And this is actually true for, as I said, all ages, all stages. I talk about women, I'm also talking about girls' health. Please submit your work to the Organization for the Study of Sex Differences. It's an international organization that brings together people across all 4 pillars of research. Including clinicians who have an interest in sex and gender, those 3 things I said, so differently, disproportionately, and now I already forget what the last one was, but anyway, specifically, I guess. Please send your trainees. There are tons of awards. I'm going to be very honest, our American colleagues really need us right now, and this is a great chance. This is supported by both NIH for now, and the CHR, please think about it. March 3rd is the deadline. So thank you. That's all I had to say. And I'm available for questions afterwards and discussion. Thank you. Keep it going. Okay. Keep going, keep going. There we go. Padma. There's Padma. Okay, great. Thank you.
So I've grown my hair since that picture. Tells you how long ago that picture was taken. So I'm Padma Kaul. I'm an epidemiologist and I work with big data. And I'm also a policy analyst. I come from a policy analysis kind of background with health economics thrown in there. So my whole shtick is data. I don't think we can manage anything that we cannot measure. So getting good data to help all the previous speakers, what you've heard in women's health and children's health, is what the goal is of developing this data hub. And what we have done is, I'll talk to you about the Alberta Pregnancy Outcome and Birth Events Registry, or it's called the Alberta Probe Registry. Just focus on the blue right now. These are all the data that we have linked at the patient level between the mothers and the babies. This includes the population registry coming, if there's a person in Alberta who has an Alberta health insurance, they come into the registry. We track inpatients, outpatient visits, their physician visits, Alberta is a great place to do this kind of population health research because we're one of the only provinces that have complete prescription drug so when you go to fill out your prescriptions, that record is linked here. We have centralized labs on everyone. There's great perinatal data as part of the healthcare system. The birth registry gives us key information that links the mother and the baby. And so then we can track what happened to the mother during the pregnancy to see what is happening in the child. During COVID, we were able to link the COVID immunization and testing database to this data, to these data. It's linked at the neighborhood level to census information for socioeconomic factors. And then there is potential to link to environmental information, which would be really important for those who are interested in climate change, etc. The data currently, as of 2005, we have information on 500,000 women who gave birth in Alberta, and they gave birth to about 900,000 babies, so we are following them. And we have the information on about 4,000 stillbirths. So when you look at this and you see the longitudinal nature of this data, these data, you can see that we have about a median follow-up of about 8 years in the mothers as well as the babies. I think that this makes the Alberta data almost comparable, if not superior, to some of our Scandinavian countries that have historical. They are great. They started in the 60s. We've started in the 2005, but yes, but I think that that's the, I think, it's an incredibly rich data resource that I hope all of you will consider using, because data is data until you convert it into knowledge. So ask good questions. We'll let you know whether they're able to be answered using these data. And then, that's what this whole hub is there to support. So what have we done? We've looked at maternal pregnancy factors and how they, such as diabetes during pregnancy, preeclampsia, complications and conditions during pregnancy, opioid use. So these are all the kinds of projects that we have on the go. We want to look at early childhood factors, such as the exposure to breastfeeding, what their birth weight was, antibiotic use during the first 2 years, how does that impact their long-term health? Social determinants of health can be looked at using these data, material deprivation, ethnicity, immigration status of the mother. And then we recently started, through our linking with the environmental data, looking at built environment, the availability of playgrounds, walkability index, and how that impacts child health. So what I do want to go back to is now the green. The future is where we want to go, what is listed in the green box. There, what Todd and Oana are doing in the genetics space, we want to start linking the genetics data, who is getting screened. By the time you identify a child with a potential genetic disorder, we want to know what history, like where did they get there? Can we build algorithms to say the next kid who walks in, we could find them sooner, get them quicker to the clinical work, to the clinicians to see. We are looking, all these data are really administrative in nature. So that is what the health system is collecting. What we don't have is patient reported, like who is your partner? What over-the-counter medications did you take during pregnancy? So all that we're missing. So we have a CFI project that is creating an app for pregnant people to actually provide that information that we can then link back to this fantastic administrative data. Of course, Connect Care is a boon. We are trying to see how we can extract. Piyush, you've come at the right time. So Piyush wants to link in Connect Care data and to make these make this an even better resource. We want to look at bringing in fetal imaging to do some AI, imaging work to see who has any congenital heart disease, etc. So those are there. And then Alberta has a rich history of having, cohorts like All Our Children and Apron. So linking those historical data from those individual pregnancy birth cohorts to this common data is where we are going. I think that's it. That.
Okay, so my name is Anastasia Voronova, and I'm an associate professor in the Department of Medical Genetics, cross-appointed to cell biology, proud WCHRI member. Past couple of years, I think we have been nurturing this idea that we really need to start a human stem cell core or facility here at U of A because we don't have presence in that space. And it's more underscored recently by this idea that we traditionally model human disorders in animals, but of course a human is not a mouse, is not a pig, is not a dog, and so the list goes on. There's also another sobering fact that about 90% of the drugs fail in human clinical trials. And so there's an enormous cost that's associated with putting basic discovery to a product in an animal model to then fail in human clinical trials. And so the FDA has recently announced that to help combat or speed up that process, that the drug candidates that show success in clinically relevant human cells may be approved for clinical trials without additional animal testing. And so I think that the time to invest into this now. And so this is what we're doing with WCHRI. So what are these human stem cells? There's a variety of different ways how you could work with them. So there are human embryonic stem cells that are derived from surplus IVF embryos that would be targeted for destruction. And then there's another way how you can work with them, which is just deriving human-induced pluripotent stem cells from any patient or any healthy individual. So that obviously opens a door, an unprecedented door to precision health, because you can derive patient samples from your specific patients. And so essentially you kind of reprogram these somatic cells that are typically derived from blood or skin back to like an embryonic-like state. And then these cells have the potential to generate all the cell types of all the tissues of a human being. Okay, so I stuck to the rules, 2 slides. So this is my second slide. So a lot of information, but we'll get through it. So what have we done? So we just are starting this initiative. It's been in the works for a very long time, and there have been a lot of things that had to fall into place. So WCHRI has invested into a small-scale human stem cell lab. So we just hired a research associate who has established this facility in Toronto. She's from Alberta, really wants to come back to Edmonton. Her family's here, and we couldn't be happier. So Dr. Dawn Zinnick is going to start in April, and so her primary task will be to build this up. I'm actively buying the equipment, and I am an academic lead on it. At the same time, for the last year and a half, we've been working on this huge CFI infrastructure fund applications. It's about $11 million. And really the idea there is to automate and scale this facility up so that it would be available to everyone at U of A who is interested in modeling their disorder of interest in these cells. But it's more than just modeling. You can think about it as a diagnostic avenue. So I'm going to skip to the last point and mention the Translational Genomics Hub that we just heard from, that this could be a way how you could functionally annotate the variants of uncertain significance or any kind of variants that you're detecting in your patients. Could be a prognostic platform because a lot of the variants are sort of typos in your DNA. They don't just cause the disease, they also cause your influence your disease progression or how you respond to treatments. So in a way, you could use these cells to weed out drugs that will or will not work for that specific cell type. And then the last thing is drug screening, drug discovery, and drug development. And so this is the trifecta. And so we want to automate it and expand it. And so that's really what the CFI Infrastructure Fund application was for. We've had support from One Child, Every Child. So they have funded a couple of catalysts and now say here a team grant, maybe not yet official, but things are looking good. So this is where we're going to pilot some of the already funded projects and really build some showcases that we will then be able to roll out and expand to the entire community. And more importantly, Dr. Sandeep Gupta, who was hired jointly between WCHRI and cell biology. And so he is a human pluripotent stem cell expert and actually models neurodevelopmental disorders, including autism and spinal cord organoids. We think about brain all the time. We don't really think about the sensory perception and spinal cords. Maybe it's time to change that. And I'm happy to say that this initiative has been supported by experts across Canada. So I've been able to recruit several individuals who are expert in this human pluripotent stem cells to really build the strength here. So Thomas Durkin, Julian Moffat, Justin Chun, and Lisa Julian. And so I think that while I only specified the Translational Genomics Hub here as a platform that this will obviously harmonize with, I just want to reiterate that I think it will harmonize with all of the platforms that have been introduced or reminded of people here today. And it aligns perfectly with the strategic research plan and the overall strategic plan of U of A SHE, which promises a transformational impact by 2030. So in my opinion, there's nothing more transformational than modeling health outcomes and diseases in clinically relevant human cells. So we can hopefully reduce the time that it takes from basic discovery to product development to actually rolling it out in the clinic. So I'm very happy to chat more. With that, I think that I am the last person, right? Yeah.
Well, thank you to all the leads that just presented. That was amazing. I'm just going to finish with a couple of announcements of upcoming activities on February 26th. You can see WCHRI TAC is seeking to have interest of new trainees to express that interest by February, end of February. We have a networking dinner for WCHRI early career researchers, supported by the One Child, Every Child, Upper Crest Cafe. And there you go. That's March 6th. And then May 6th, we have an amazing speaker coming in. Piyush has spearheaded this to have, I can't pronounce the last name, Agiapur. Anyway, not quite. Anyways, but do come and see that seminar. It's going to be fantastic. Amazing speaker. And with that, I'm going to thank everyone here and everyone online that's been here. Really thank the foundations, but also really like to thank the staff and the personnel of WCHRI that really supports our members that are here. As you saw, the team of research coordinators, we have grants over there with Michelle and her team. We have communications and stewardship. We have data people. We have every walks of everything you've heard today has been supported because we have staff and amazing committed people who are here because they're committed to improving women and children's health. I see Jackie over there, financial, can't forget about the accounting part. Luann's probably online here. So really a big thank you to everyone that works and supports the endeavors that happens within WCHRI. Tanya, oh my goodness, over here. If you haven't met Tanya yet, you will. And with that, we're going to open it up for some questions and then networking. Katie's going to keep track of any questions that come online. Maybe if everyone, does anybody have any questions? And then maybe we can just speak up for within the audience. So anybody here have any questions? Yes, Spencer.
The other day when we spoke, you mentioned that maybe something we don't do well enough is linking the institute with the university. And I'm wondering if I can put you on the spot.
Who said that? Who said that?
That cool graphic at the beginning at university was the umbrella. Number one, do we need to rethink that a little bit? Should it only be the U of A as the umbrella? Is my first question. And can you maybe charge us with what we can do better to help the institute with that connection?
Yeah, so if people online didn't hear that, it's more about how does WCHRI connect within the University of Alberta better? We're very supportive of the University of Alberta. We wouldn't be here with lights and labs. But at the same time, in the Education Act, we're set up by faculties, departments, now colleges, and then we have these institutes. They're not really part of the structure of the University of Alberta. So we always have to remind our colleagues about, don't forget about the institutes, and especially the Women and Children's Health Research Institute really specifically has its own unique needs with community. We have 2 amazing foundations. We have 2 amazing hospitals. We have Alberta Health Services. So I guess what we can do as individual members of WCHRI is just always recognize WCHRI as your member institute, because that goes a long way. Obviously acknowledging the foundation and in the support, because even if you haven't received like a specific grant today, you're a member of WCHRI, so you have the capacity to have this amazing support in this community and this networking. So I'd say the first thing we could do is all highlight our membership within WCHRI, but also always thank the partners that we wouldn't be existing without them. And then there's a lot more to that. But again, I guess championing your institute, and we all belong to different institutes, different faculties, different departments. That doesn't mean you throw out all the other ones. It just enhance within that when you're working in Women and Children's Health, the WCHRI Institute. Good question, Spencer. Any questions online? So, because after this, what we'll have, I know some people have to leave, it's because it's on the hour, but if you have time, please stick around, not only to talk to the leads that you heard from today, which was great. Thank you again to each one of you for all the work that you do, but also we have many staff members here in many research coordinators in the room today. So please stay, and if you don't have any questions, at least network and get to know each other, because we're actually here in person. So, and for those online, thank you again for attending and being here and having an interest in what we're doing within the Women and Children's Health Research Institute. And with that, I think we say goodbye to our Zoom audience and we continue with our in-person audience. So again, thank you for everyone online. Do you want me to lead the meeting from here? I'm going to take that as a yes.